Do you often feel bloated, gassy, or experience dull pain in the upper abdomen, especially when you're hungry or right after eating? You're not alone. Every year, millions of people in the Philippines, Vietnam, and around the world visit the doctor for symptoms related to gastritis, stomach ulcers, acid reflux, or chronic digestive disorders. The real problem is that most of us tend to ignore early warning signs, only seeking help when things get worse, sometimes when it's already too late, and complications like stomach cancer become a real risk. So, today, I invite you to spend the next few minutes with me as we understand what's really happening inside your stomach, how to recognize early symptoms, and most importantly, what you can start doing today to protect your stomach for life. Part 1. What is the stomach and how does it work? Your stomach is a muscular sac located under the chest, between the esophagus and the small intestine. Its job is to release acid and enzymes to digest food, churn it into a mixture called chyme, and pass it to the intestines for absorption. To protect itself from its own acid, the stomach is lined with a thick mucosal barrier. But if this lining becomes weakened or inflamed, the acid starts eroding the stomach wall, leading to pain, ulcers, or even perforation in serious cases. Part 2. Common stomach conditions. Here are 5 common stomach-related conditions you should know about. Acute and chronic gastritis, inflammation of the stomach lining, causing pain, poor appetite, nausea, and bloating. Gastric or duodenal ulcers, open sores in the lining of the stomach or small intestine caused by acid damage. GERD, gastroesophageal reflux disease. Acid backflows into the throat, causing burning. Sour taste, coughing. H. pylori infection, a bacteria that survives in stomach acid and contributes to ulcers and stomach cancer. Stomach cancer, often silent in early stages, only discovered when symptoms are severe or advanced. Part 3. Signs you shouldn't ignore. Watch out for these signs. Persistent pain or burning in the upper abdomen, acid reflux, bloating, burping, nausea or vomiting, appetite loss or unexplained weight loss, black or tarry stools, a sign of bleeding, chronic fatigue, anemia. If you experience 2 or more of these symptoms regularly, you should get checked by a doctor immediately. Part 4. What causes stomach issues? Here are some common causes of stomach damage. Irregular eating habits, skipping breakfast or late night meals, eating too fast, poor chewing, frequent alcohol, tobacco, or caffeine use. Overuse of NSAIDs like ibuprofen or aspirin, prolonged stress and anxiety. H. pylori infection, spicy, oily, salty diets and processed foods. Part 5. How is stomach disease diagnosed? To find out what's really going on inside your stomach, doctors may use endoscopy, a camera tube inserted through your mouth to look directly at the stomach lining. H. pylori testing, breath, stool, or blood tests to detect infection. Blood tests and ultrasounds to check overall organ health. Part 6. Daily habits to prevent stomach disease. You don't need to wait until you're sick to care for your stomach. Here are 7 things you can start today. Eat meals at the same time every day, especially breakfast. Eat slowly, chew thoroughly. Give each meal 20+ minutes. Avoid eating too much or too late at night. Cut down on alcohol, soda, strong coffee. Sleep well. Aim for 7 to 8 hours per night. Practice stress relief, breathing, walking, journaling. Don't take herbal pills or supplements without medical advice. Part 7. Best foods for a sensitive stomach. What to eat? Soft rice porridge, boiled vegetables, steamed pumpkin, carrots, sweet potatoes, boiled eggs, lean meats, tofu, plain yogurt, warm water, ginger tea, honey water in the morning. Avoid spicy foods, raw garlic, strong onions, fried and oily dishes, soda, processed snacks, sour fruits like oranges, lemons, green mangoes. Part 8. Healing takes more than medicine. I've met patients who had stomach pain for 5 to 7 years, trying every medication out there, but nothing helped long term. But once they changed how they ate, learned to manage their stress, and slept better, their stomach began to heal. The truth is, your stomach isn't just affected by what you eat, but also how you live, how you feel, and how you rest. Final word, don't wait until it's too late. If you've been feeling off lately, with digestion, appetite, or stress, please don't ignore it. Getting a proper diagnosis early can help you avoid serious complications and even extend your life. Starting today, you can protect your stomach one meal at a time with a warm bowl of porridge, a calming herbal tea, and a regular sleep schedule. Thank you for watching. If this video helped you understand your body better, please share it with someone who needs it too. You might just help them avoid a lifetime of pain.